Hi everyone. So today in the Shepparton area there's 281 active cases of people with COVID-19, and in the last 24 hours that's an increase of 32. Across the Goulburn Valley area, the local public health unit that we're responsible for, there's 506 active cases and 44 new cases in the last 24-hour period. So COVID is still spreading around the community, as was and is predicted and expected to occur in the coming weeks and months. The best thing, of course, people can do as soon as you notice any symptoms of COVID, we want people to still come forward and be tested. So even though the restrictions are starting to ease and pleasingly the vaccination rates are starting to pick up, we do know that there's a number of people in the community that still aren't vaccinated. Of course, people aged 11 years or younger, who we are still, of course, seeing some transmission amongst primary school age students. So anyone who has children, and if they've got symptoms of COVID-19, get them tested straight away, and that also then includes for any household contacts and members of the community as well. So looking ahead, we know, and as I said a minute ago, expecting that COVID will still be transmitted around the community, and what we all need to do individually and collectively is to remain vigilant in terms of, as soon as you're noticing those symptoms, being tested straight away, and that's going to still help us keep on top of reducing the case numbers and the spread in the community. I'm happy to take any questions from there if you like.
We saw over the weekend, and of course in the last few days, there's been quite a number of exposure sites pop up, not necessarily tier ones, but just individual businesses. Is that really just going to be the norm from here on out? It
will be, absolutely. So people are, in general, business owners are doing the right things. I know, having been out a little bit over the weekend, people are still checking in and showing their vaccination certificates, and that's a big thing that we're going to have to get used to, of course. And it's important, I think, to support the business owners in that sense, because they've just got a job to do, and we need to make it as easy as possible for them to do their job as well. But in terms of exposure sites related to that, it's possible that they'll continue, of course, to be listed on the department's website, the high risk and the areas that the contact tracing team and public health units are really concerned about. But equally so, sometimes there will be examples where businesses will post that information on their own, say, social media platforms and other means to share that information around the community, and I think that's perfectly acceptable as well, and that's part of us transitioning to a more COVID normal environment. So expect to see, I think people can expect to see a blend of businesses doing their own notification, but also, and that's again based on risk, and it will continue to have the department and our teams listing exposure sites as well.
Are we expecting the same to happen with schools? We've seen a few of them, open and close, and open and close, and especially with primary schools, most of those students being unvaccinated. Yeah. What should people expect on the schools front? So in general terms, there still will continue to be schools listed as exposure sites, because we know, large numbers of people in small spaces, that's where that's where the virus is being transmitted. It also comes back to people always being vigilant to wearing masks. In terms of more broadly, there is a transition now to the management of schools being a bit different to what it has been, with the local public health units, say in our context, having less of a role. There's two things that are happening in that regard, whereby the schools are being managed and supported a bit more centrally from the Department of Health's public health unit and their contact tracing teams, but also more and more the schools, as we're becoming more accustomed and familiar with COVID, they're playing a greater role in identifying students and staff that might be of concern in terms of ongoing transmission into the future. So schools will continue to be a concern, particularly as we get closer to year-end exams for Year 11 and Year 12 students as well. And it's been a fairly challenging period for any child, I think, or any student, but to try and manage that and keep on top of that risk for the schools is really important, but the schools are going to have a big role to play in that as well. Yeah.
And how have the testing numbers in Shepparton been? There's a decent line out there at the moment.
Yeah.
Are you expecting, like, how many tests have we been doing on average?
In general, our numbers have been around 400 to 500 people being tested at our sites, at the respiratory clinic here in Graham Street, but also at the drive-through centre at the at the Shepparton Showgrounds, just adjacent to the Macintosh Centre. So they're pretty consistent, but again, we shouldn't drop our guard in terms of testing either. As I said before, anyone who's got symptoms of COVID should get tested straight away and don't delay that either.
Do you have the hospitalisation numbers for Shepparton?
At the moment we have 9 people in hospital, 7 in the general respiratory ward and 2 people are in intensive care and they're both on a ventilator.
In terms of today's cases, are they mostly linked, or are we seeing still more unlinked cases come through?
Mostly linked, and as we talked about a few minutes ago, a number of the exposure sites are related to schools. So often and unexpectedly, when you have a student test positive, they've got at least 2 or 3 generally household members, and that's where there's some positive cases. But a number of schools are involved as well at the moment.
Yeah, we've got Melburnians able to come up on the weekend as well. Do you have a projection of how much that'll increase cases into next week, or?
It's difficult to say just exactly what that will mean specifically for our region, but in general, consistent with the Burnett modelling, that there's predicted to be a little bit of a lull in positive cases, newly diagnosed positive cases towards the end of October and into early November. But from, say, the 2nd or 3rd week of November through to Christmas and early January, we're going to get to about the same numbers or more in terms of total active cases. So I think for Shepparton, we should expect to see about the same number of active cases in the coming weeks, and potentially an escalation from there towards through November and December.
Do you see a need to increase testing capacity as we're starting to see more of these exposure sites and the schools as well?
We've got some contingency plans to increase testing capacity if we need to. We can add more lanes, for example, at the Shepparton Showgrounds site, and we know we've used other locations as and when we've needed to right throughout the pandemic. My sense is we won't need to add new locations. It would be more about increasing the capacity at the 2 sites that we're currently operating at the moment.
There was a lot of discussion this morning about Indigenous vaccination rates in the Melbourne press conference. In Shepparton it's still a little bit lower than the rest of the population as well. Has there been additional support given to Rumballara from you guys, and what's that support?
You're right. The overall, I don't have the exact figures today in terms of Indigenous vaccination rates, but they are lower. I know Rumballara Aboriginal Corporation have been working hard with one of their peak bodies, Victorian Aboriginal Community Controlled Health Organisation, and the Department of Health to increase vaccinations in and around Shepparton and Mooroopna. We've also had some discussions, and they're still ongoing, with Rumballara about one of the buses doing some vaccinations at a location in town. So they're progressing those conversations, but certainly that's one of the reasons why we've gone with the second bus vaccine last week, is to take vaccination to areas around the community that we can be a bit more portable and responsive to meet needs, and working with Rumballara to vaccinate Indigenous folks will be certainly a priority for us as well, where they want us to help too, I should add as well.
Thanks, Matt. Appreciate it.